You may be asking, what's an epiglottis and how can my epiglottis ruin my sleep? In this video, I'll reveal something that most sleep doctors never think about if you have chronic sleep problems that just won't go away. Hi, I'm Dr. Stephen Park, an ENT surgeon and sleep medicine doctor. I'm also the author of the Amazon bestselling book, Sleep Interrupted. A physician reveals the #1 reason why so many of us are sick and tired. One of the most gratifying things that I was able to do as a sleep surgeon is to help people breathe better and sleep better through lifestyle changes, dietary changes, medical devices, and even with surgery. One of the more common procedures that I started doing many years ago was something called drug-induced sleep endoscopy, also called DISE. This is when I look at the upper airway with a flexible camera through the nose when the patient is sedated, like for a colonoscopy. Besides the more common findings that you would expect to see with obstructive sleep apnea, like the tongue, palate, or tonsils collapsing, I also saw something that I didn't expect to see, where the epiglottis caves in and blocks the airway during every breath in. So what's the epiglottis? The epiglottis is made of cartilage and it's lined by mucous membrane, and it makes up the topmost part of the voice box. So just below it are the vocal cords, and behind it is the tongue. It's thought to cover the airway when you swallow to protect you from aspirating. And how does it cause sleep problems? Let me show this video. Notice how with each breath in, the epiglottis here flops in, and then with every exhalation, it just opens up. And at the very end, when I lift the jaw forward, everything opens up completely. So how is this related to or different from sleep apnea? With sleep apnea, you're going to see other areas caving in, like the tongue base or the soft palate, or the tonsils caving in from side to side. But here you have something totally different called the epiglottis that caves in, and it can present as an apnea, or it'll cause much shorter obstructions and arousals, which ends up fragmenting your sleep. It's not commonly described in adults, but it's seen much more commonly in newborns and infants. And so when they have severe breathing problems, it's taken care of quickly. But oftentimes, a chronic low-grade version of it just lingers throughout childhood and even into adulthood. Now, why are we seeing it more commonly now? As I talked about in previous videos, and also what I talk about in my book, modern humans' faces are shrinking. So our faces are getting more narrow and longer, and it's thought to be due to soft diets, bottle feeding, thumb-sucking, pacifier use, nasal congestion, mouth breathing, endocrine disruptors, fluoride, which helps to prevent cavities but also hardens bone prematurely, and maybe even glyphosate, the weed-killing agent that's sprayed in all of our crops. And one of the known pathways that causes health problems is that it blocks the chondroitin sulfate pathway, and chondroitin sulfate is a precursor before tissues become cartilage and bone. So what I found oftentimes when I was operating with these kids is that the epiglottis was very soft like tissue paper. It had no structure or support. And so you can imagine as you breathe in, it just kind of caves into the back of your throat. But also it's not just the epiglottis being soft, but since the jaws are smaller, there's less space for the epiglottis to sit in, and it's kind of pushed back to begin with. So all of these factors lead to the epiglottis flopping in much easier than what we saw maybe 50 years ago. Typically, the consistency of the cartilage should be like your nasal cartilage or your ear. But if you feel the cartilage in these children or even adults, the nasal cartilage and the ear cartilage is softer than usual as well. So how can you diagnose this? Typically, you're not going to see it when you're awake, but rarely I have seen it in a handful of patients while awake, but most of the time you can't see it. And the only way to diagnose it is under drug-induced sleep endoscopy. And what can be done about it? Well, unfortunately, I haven't seen anything that works except for surgery. However, there was one case report that I saw where they applied tongue exercises for epiglottic collapse. I think the patient did it for about 6 months and he was cured completely. And this was documented by sleep endoscopy, and the sleep apnea score went down dramatically as well. And there are different ways of treating it, like stiffening it or tying it or cutting off a portion of it. And there's pros and cons of all the approaches, which I've done. But in general, the more conservative it is, the lower the overall success rate and the higher the chance of recurrence later on. The more aggressive it is, the higher chance of success, but more risk of complications. However, if you look at the literature looking at complications from these kind of procedures, surprisingly, the complication rate is very low. And we actually did an informal study of about 40 or 50 children undergoing this procedure, and we had no long-term complications, such as swallowing problems or aspiration. So if you think you have it, who can you find to help you? You need to find an ENT or ear, nose, and throat surgeon. And typically the pediatric ENTs do this more often, but they may not be willing to see you if you're an adult. Also, you may want to look for surgeons that perform what's called the Inspire procedure. This is a tongue-based pacemaker where they simulate the nerve that goes to the tongue. And by definition, they have to know how to do the sleep endoscopy really well to see if you're a candidate for the other procedure. So you can search out an Inspire surgeon by going to inspiresleep.com to see who you can find close to where you live. I hope you found this video helpful. Overall, epiglottic problems are not that common, but it happens often enough in patients with chronic sleep problems. So it definitely has to be thought about if you can't figure out why you can't sleep despite trying everything. As I mentioned before, there are many other reasons why you can't sleep. Click on the link above to find 2 more surprising reasons why you can't sleep.